My grandfather, who I idolized, was a doctor and had served honorably in World War II, and I saw him as a healer of people, and it was a way to give to my community and to help people in need, and that's something that always appealed to me. My name is Jean-Claude D'Alleyrand. I'm an orthopedic traumatologist here at Penn Medicine. I do what's called hot trauma, which is stuff that's fresh off the street, so fractures, open dislocations where the joint has been exposed, or big wounds to the limbs and pelvis. Then there's warm trauma that's brought in from outside hospitals but just recently happened. And then there's cold trauma. There's the surgeries or injuries that are in the past but the patient still hasn't finished healing or isn't going to heal. Some fractures, and also deformity correction too, and also do amputation surgery. Unfortunately, had to do quite a bit of in my time in the Army, and I have a lot of expertise with that. I try to be exceedingly thoughtful about each of my patients and balancing their needs, who they are, their social situation, and matching that with their injury. There is more than one way to treat a lot of injuries and fractures, and not all are appropriate for every patient. Any endeavor with any sort of complexity generally involves a team. As the surgeon, the knife is in my hands, but I am surrounded by a surgical team in the OR. Outside the surgical team, there's the anesthesia team, the nursing team, and then there's the trauma system itself and all the other subspecialties that are caring for the patient. It would be impossible to take optimal care of a severely injured patient without a good team. And without the team, the individual is nothing. A lot of times with trauma patients, we have large parts of the skeleton and or limb missing, and that needs to be reconstructed, and there's a variety of ways to do those reconstructions. We have phenomenal microvascular surgeons. When you have truly all options on the table and great minds on either side of you, it allows you to be the best provider that you can be, which is pretty exciting.